The PL Show is brought to you by Kel Chaco, Kel 360, and Kel Kids Toothpaste.
Hello there, you're welcome to the Kel Toothpaste PL Show. The show is brought to you kind Kessie Kel Toothpaste brands, Kel Kids, Kel 360, and a Kel Chaco. Toothpaste, these are the brands you should go for. In Colana bet me use Kel Kids, in Colana woman di infianciano, on bet me use Kel Kids. And then those above the age of 6 can use Kel 360 and Kel Chaco. Name mama. Kel Happy Smile. My makeup is by Cover GH Beauty and Express. Then no baby say Kel Toothpaste PL show no so and they are March 20th and today is World Oral Health Day. And yenso dear in koma yetabo hapa how to use Kel toothpaste to clean your mouth well. But yet in commoni nyina no no nti na World Oral Health Day no. Ye de obi a owo hu nimdeɛ doctor owo hu se hu ne wenumu hu yare hu nimdeɛ a obetrɛtrɛ how to prevent those decay or cavities and plaque in our mouths. And edwumadie no ye best start it, but before then no me pese wo hu say it's really important, it's very dear to our hearts because we say you should make up fefe, but the best one say washre and now say was smiley. Oh, sina ubeyi the betre no. It was say very beautiful. Na no kwan cancel be free no abano. It needs to be good, and that's why we are here today. So you're welcome. My guest is Dr. Theodora Ewura Esi Eghan. Oye dentist at Ridge Medical Center. You're welcome.
Thank you.
So, obi wo ha ya ka dentist, but e bia on call dentist order. Would you mind saying?
Okay, as a dentist, me do my true pertain and say I take care of people's oral health. Any yaribia it pertains to anything in your mouth, your teeth, your gums, your tongue, and everything. Say measure so now I make sure that you're healthy when it comes to your oral health.
I see. Yeah. So then this day, March 20th, which is World Oral Health Day, what is it all about?
Okay, so World Oral Health Day basically a diet to create awareness about our oral health, especially for us in developing countries. Africa, Ghana, most of us don't take our oral health seriously. It's 20th March of every year. We take the time to create awareness near church and call for how to take good care of their oral health, what they can do to make sure that their oral health is in a good condition. So that's basically what 20th March World Oral Health Day is about, creating awareness, making it accessible and easy, spreading knowledge concerning oral health to everyone.
I see. And on days like this, yeah.
Oh, okay. So on World Oral Health Day, most dentists, most organizations around try to create awareness. We do most outreaches. We share knowledge. Sometimes we go to schools, institutions. Every now and then we also do oral health care screening for people. So on such a day, we are just telling everybody that you should have a happy smile. And then for this year, 2025, World Oral Health Day, our theme for the 2025 is a happy smile, or a happy mouth is a happy mind. Yeah,
I see. So it's just like Kel happy smile.
Great.
But
works well.
What exactly is oral health?
Good. So oral health is the healthy state of your mouth, basically, and everything in your mouth. Healthy teeth, healthy gums, healthy tongue, tonsils, and everything that has to do with your oral health, to ensure that you have a total well-being, because we say that your oral health is directly linked to your total well-being, and also your
Right.
psychological health. And that is why this year we are saying that a happy mouth is a happy mind, because it will affect all aspects of your health, including your mental health as well.
I see.
So,
I mean, we know the tongue, teeth, gum,
yeah.
but you mentioned tonsil.
Oh yes.
For
So
those who don't know what that is or where it is in their mouths, what or in their throats, what is it?
So your tonsils are basically at the far back of your mouth. When you open your mouth, you see these two projections at the back. And then it also signifies a healthy mouth. Like you could have tonsils, so you could have diseases of the tonsils as well. Aside that, we also have what we call the periodontium. That's really in your mouth. That your gum is a part of, by the bone in which your teeth sits in. We have some fibers that connect to the teeth as well. All these things come together to form your periodontium.
Wow.
Yeah.
And then they know medical
And then they
school.
school.
But what kinds of diseases could not taking care of your oral health bring to you?
Okay, so the easy one we all know, the nayenim kaka. Yeah, it's the #1 disease everybody knows, and it's basically called caries in English terms. So it's like a disease of your tooth where you have a cavity or a hole in your tooth, and then it continues to degrade your teeth, and it gives you so many other things. Yeah, like can give you bad breath, it gives you pain, it can cause an abscess and all that. We also have periodontal diseases. These are basically diseases of your gum and then the structures that hold your teeth in your mouth. So gum diseases, because so mojaba, yellow around the teeth and all that. These are plaques. They will affect your gums, and then they can give you what we call gingivitis. So now your gums now you're very red. And then when you brush or the little touch, it will bleed. And then also over time it will progress to what we call periodontitis, where your tooth now becomes even loose, and then it may fall out of your mouth.
Wow.
We have other diseases like maybe trauma to your teeth. ABI, you fall down or you get into an accident, you fracture or you break a tooth, a piece of tooth, and you will need a dental care for it. And we have other diseases too that can affect the soft tissues of your teeth, like your tongue. We have the oral cancers and all that. We have diseases that can also affect the bone in which your teeth resides in. So yeah, oral health is broad. The diseases are also many, but then the commonest that most people know is the caries or the caca. Yeah, we also have bad breath that can affect most people, and they don't know what's causing it and all that. Yeah.
And you talked about causes, which is where I want us to go now. What causes some of these diseases?
A poor balance of the microbes in your mouth. So everybody has normal bacteria or microbes in their mouth. And if you are eating poorly, not keeping a good oral hygiene, what you are going to do is you are going to distort the pH balance in your mouth, create an acidic environment that will begin to melt down your teeth or degrade your teeth. So let's say you're eating a lot of sugary foods. Let's make it simple. You're taking most sugary foods, and then these foods, what is going to happen is that the bacteria is going to feed off of this sugar that has been left on your teeth. Let's say you chew toffee or biscuits or anything at all, even unusual banku, fufu, it will become sugar eventually. It remains on your teeth. The bacteria in your mouth work on these sugars, and then they produce an acid. And then this acid then tends to create cavities. They degrade your teeth. They cause holes in your teeth. Once there's a hole in your teeth too, the more food you eat, the more food packs in this cavity. So it becomes like a vicious cycle. The cavity gets bigger and bigger, and then you're having diseases. So mainly our oral health habits or our oral hygiene habits, and then the food, the type of food that we are eating, and the frequency of eating too as well.
And then you said, what makes us also vulnerable to oral diseases is poor oral hygiene.
Yeah.
What's that? And what is oral hygiene?
Oral hygiene. So when we say oral hygiene, it's basically the things you do to make sure say your mouth is in a good state. So are you brushing your teeth? Are you flossing? Are you brushing your tongue well? Are you seeing your dentist?
Doc, we better say, I brushed my teeth already. Me chuchu mesi debi auntie. Why do I need a dentist? Ne flossing, ne sani amana wakani nyina no. And I want you to take us through why when we come back. You're watching the Kel Toothpaste PL show on this day, World Oral Health Day. Our focus is on keeping your oral hygiene not fair, not medium, but excellent. So stay with us, don't go away.
Anti-cavity, gum protection, brighter teeth, and fresh breath.
I'm a fat missy way.
The patch of Bantama.
Matias.
It's her smile.
The fresh breath.
Me Jidi say we use Kel 360 toothpaste. Some kind.
Kel 360 toothpaste.
Gaskia, Kel 360 toothpaste. It's a gum protector.
Onim jom kasa. Kile kosen. Kel 360 did the way. It's cool mint. Gives me fresh breath and your confidence booster.
Hey, you will see feeling when you know Kel 360 toothpaste.
Happy smile.
Kel 360 toothpaste, anti-cavity, gum protection, brighter teeth, and fresh breath. Kel, happy smile. This advert is FDA approved.
Welcome back. Ye mama kwaba biom eba edumedie so your friend Kel Toothpaste PL show. And this show is brought to you by the Kel Toothpaste brands, Kel 360, Kel Charcoal, and Kel Kits. Mamenka Kel 360 is FDA approved and safe for both adults and children as young as 6 years old. This toothpaste delivers comprehensive oral care for everyone. It will protect your gum, will fight cavities, and keep your breath fresh all day long. Whether you're gearing up for an important meeting or a fun day out with your children, Kel 360 has you covered with its all-in-one formula that gives you confidence in every smell. Today is World Oral Health Day. Doc, so mechuchi mesi dada, ebi anopa mechuchi enyumre nso na maye ansa na mada. Ebi mu wa because eduane bi obedi bi obetwi nese. You can comment on that as well.
Yeah.
Say healthier. But se mechuchi mesi says na me use mouthwash. I didn't na me here flaws. Na mean some who dentist, every now and then.
Sure. And so no, you're brushing maybe twice daily. But the fact is that most Ghanaians don't. Let's be realistic. Yes, most Ghanaians don't.
Yeah.
And some, if they will be true to you, will say even the days that they do it, sometimes after doing it, they'll eat. Something will call you or something. And So if you're brushing twice daily, keeping a good oral hygiene. It's not just about brushing. And yes, will say keke. Even the brushing, how are you doing it? There's a proper way of doing brushing, and there's a proper technique. And you should use proper dentifrices, like the things that we are using to clean our mouth. Okay. And your brush be now, it's healthy.
Now brush when the infant is
So we recommend the medium bristle toothbrush for adults. Say you're paying 6 years and above, like you said, you should make sure you are getting a medium bristle toothbrush. Some people prefer the hard ones. Nah, it's not a gata.
That's hilarious.
Yeah, because people want the any hard
a smoker's brush. There are some brush brands that they write on them that is for smokers, and those ones are really hard. No,
because as the name suggests, it's supposed to be able to take away smoke stains from your teeth. And so if you are not smoking, you don't have smoke stains, you are using that brush. What you are doing is you are wearing off the enamel, which is the protective layer on your teeth. Now more problems, baby. You start having sensitive teeth. Something sugary, something acidic, you have that sensitivity. And with time, some people do it all the way to the extent that now their tooth breaks off. So we are saying use a medium bristle toothbrush. You are brushing, are you using the right toothbrush? What toothpaste are you using? We recommend a fluoridated toothpaste. And Kel has fluoride in it.
It does.
Exactly. So we are recommending that you get a fluoridated toothpaste as much as possible, be it for kids or for adults. We have recommended amounts in them. And then also the technique.
Before you talk about the technique, what kind of brush should we give to our children to?
So usually babies or children have soft bristled brush.
Okay.
Exactly, because their gums are softer, just to be able to go to the, and then they have smaller heads. That's why it's important to get kids toothbrush for children. And then I was going to the technique.
The technique, yes.
How are you brushing? Most of us do this and that.
Is that not how you work? Is that not how we work on?
Well, but
a hakakra.
some of us, we don't pay attention. It's become second nature. As we are brushing, we are singing, we are thinking, we are humming.
Yeah.
But no, we are supposed to brush in circular motions.
Oh.
So you go in circles, you angle your toothbrush onto your tooth surface. So angle, just make it so flat. What we want the bristles to be able to go into your crevices, like spaces near what Austin chain to be able to bring out all the food particles. So it's more about technique and not the strength. And also, we recommend that if you are using mouthwash, you should use a fluoridated mouthwash as well. Exactly. And then when you use your mouthwash, which is fluoridated, you have to wait 30 minutes before you eat or drink. So
why is that important?
It's the same way as brushing. Ideally, when you finish brushing, you have to wait 30 minutes before you eat or drink.
I see some people like to eat before they brush their teeth.
Yes, but most people will wait. Once they see the watch, that's when they'll quickly go brush and come and eat. What you've done is you've wasted the toothpaste.
Yeah.
The toothpaste has to have fluoride to protect your teeth. It is as it remains on your teeth that is working. So we say at least 30 minutes. Don't eat right after. Don't drink right after.
Mate, some dentists recommend to choose in
yeah. So ideally, you shouldn't rinse after brushing, ideally. But some of us you may have food particles in your mouth, and maybe you've not brushed the night before, so you have dirt. You can actually see dirt when you spit out. So if it's too much or you have food particles, you could spit out, rinse once. And that's it. But if you can, ideally, you shouldn't rinse after. So that all in the name of the toothpaste working, remaining on your teeth. So if you have food particles or something, you just swish around once, spit out to get that out, and then you leave the rest in your mouth.
I see. No, that's it for technique. But in Kolanswe, do we take them through the same process?
Yeah, you should teach. I've realized that whatever you teach your kids, that's what they're going to grow up with. They're better in Kwalan, that's what. So if you're not teaching them the right thing to do, they will grow up thinking they have a good oral hygiene. They'll grow up thinking that's what we all do. That's what it's supposed to be, but they will not be doing it right. So you should actually do it. And then we say that you should brush at least 2 minutes. So even for the kids, we usually have this hourglass thing that we put on the table where it records 2 minutes. So you are just anything like a timer, just to make sure that they are brushing well, inculcates the habits in the kids so that they can practice it when they grow up. Yeah, so it's the same thing for the children.
Then we also have to visit the dentist. How often?
At least twice every year.
So every 6 months, so to speak.
Yeah.
If you don't have any condition.
If you don't have any condition. If you have a condition, please don't wait. May train 6 months and sana makodabi. Yeah, Ghanaians, our only reason we go to the hospital is because of pain. But most dental diseases will start and give you no pain. Most cavities will start and you will not have any pain. Gum diseases. Most of us, some people are brushing. Almost they brush, they see blood, but there's no pain. So
there's nothing wrong.
There's nothing wrong. But there's definitely something wrong. That's why I see blood in your sputum shouldn't be normal.
Yeah.
Exactly.
Let's talk about that bad breath.
Sure.
Talk to us about it. Is it because we are not, what could be going on there?
Bad breath is caused by a lot of things.
Okay.
You would have the patient or the person's factors. In that nipani intuition ye or your brushes up. I actually once had someone walk up to me. Oh, I have this friend. He claims he brushes twice daily. Me, I'm trying to say it's like it's clean and everything, but he has this constant bad breath. So it's not just about brushing. Some people don't brush their tongue. I've met people who don't brush their tongue. What happens is you have food accumulating on your tongue that can give you bad breath. Also, caries. Once there's a cavity in your teeth, food is going to pack in there it's going to decompose over time. Bad breath. Just like with the baby. So if you have cavity, you are not cleaning there very well, it can give you bad breath. So if you have a hole in your tooth, you are not going to the dentist, you are doing all sorts of things in the house, it can give you bad breath. Also, probably you have spaces between your teeth for one reason or the other, and food is packing there, it can give you bad breath. Also, we have certain what we call GIT diseases that can actually give you bad breath. So when you come in that you have bad breath, we're going to look in your mouth. First, I check in. Do you have a good oral hygiene? Are we even perceiving the bad breath in the first place? Because some people, it's all in their head.
Right. So what's the process? Brushing, mouthwash, flossing, or one can be before the other?
So the process mainly is brushing, then you floss.
Okay.
And then if you would use a mouthwash, you can wait. And
wait later and use the mouthwash.
Yeah.
There's a bit more we want to talk about. If Ridge Medical Center is having any event of sort on this day, as people are watching us to commemorate Oral Health Awareness Day. But before we talk about any of those, if it exists, let's take another break. When we come back, we'll talk more to Dr. Eghan.
Mommy.
Michelle say, fe.
Different era, better result. Time has changed and time has brought Kel Charcoal Toothpaste. Healthy gums, anti-cavity, fresher breath, and it whitens teeth. Kel Charcoal Toothpaste. Sankofa.
Yenchi. Kel Chocolate Toothpaste.
Happy smile.
This advert is FDA approved.
Welcome back. Dr. Ewura Esi Eghan. She's with Ridge Medical Center, and today she's helping us learn more about oral health and maybe also book an appointment with her along the way.
Exactly.
But what misconceptions do people have about dental or oral hygiene that you'd want to debunk today?
Misconceptions are a lot, but one of them is that most people believe that oral hygiene diseases are mainly genetic. Say, because say, mama papa so even if everything is going wrong in their mouth, they will not take any step because they believe they won't. He or she can't do anything about it. But that's not true. Fine, we have the genetic factors that will play a role in how everything goes or how susceptible you are, the risk you have in developing oral health diseases. But you can always do something about it. You can visit don't sit and say, papa, so a young girl or a young man, you've lost one tooth, you've lost 2 teeth, you've lost 3, now it's a home. No. Visit the dentist. Most likely, and you know, like I said, whatever you teach the kids, they grow up with it. So maybe in your family, they've been brushing their teeth wrongly without your knowledge. And you've learned it. That's what you are practicing. But probably that's not what you're supposed to be doing. And that is what is making you more susceptible to. So if you have anything, or we look in your mouth, you have anything that will predispose you or increase your risk to it, you better show your we probably will tell you that instead of coming to the clinic every 6 months like every other person, you should come every 3 months. You should get your cleaning every 3 months. All of these are things we can do to ensure that even though papa sa mama sa what they exactly.
While we are talking about misconceptions, I want you to address a few later. But before then, let me just do a quick reminder for our sponsors. You talked about fluoridated toothpaste. Kel toothpaste brands are all fluoridated, but this particular one also has that activated charcoal in it. Some of you have had the big box already. This is 150 grams, but this is 80 grams. Nti ene ketwa baako ene kese baako said be ya ne osika be so bia no na wato enye se ne boarding o, but obi wo hono mokra on pekese ese no o se kese na che dodo. Into no pay we and a santema no a fresh one. Into no, this is a Kel charcoal toothpaste. The activated charcoal in it will help remove toxins from your mouth. The fluoride in it also, as doctor has explained, is good in keeping your enamel strong. Yeah, also no white side na namebwa. Ohone enamel.
Yes, please. Yeah, you huno.
Unza minim kakra.
Unimo.
Right, it will keep it strong for you as well. Into no kona kotobi, it will still be it won't cry hand no any baby or be our Ghana. You know, earlier you mentioned that your oral health is important for your general well-being, but what is the relationship? If I don't keep my oral health well, what impact could it have? Into so bene binya ama me minipedua ni nyina.
Okay, so if you're not having a good oral hygiene, let's even start from kids. If children are not having a good oral hygiene, they're definitely going to come down with oral health diseases. The child, the whole house is at. It's going to cost you financially. Also, in your general well-being, you're not even able to eat properly. That will also affect other parts of your body or your system. Also, the children are not even able to play, move around, even as an adult. It's going to affect you the same way. Aside that, there are certain diseases. We've been able to identify links between your oral health or certain oral diseases and those diseases. Able to say diabetes, able to say heart problems, exactly. So research has found that there's a link between diabetes and periodontitis. Yes.
I see.
And we all know that diabetes is almost endemic in Ghana. A lot of adults have diabetes. And what diabetes mainly does is that diabetes is basically your body is unable to use the sugar or the glucose in your blood. And diabetes will in effect affect your immune system. And that immune system is supposed to help you fight diseases. So if you have diabetes, that is affecting your immune system. You are not able, your immune system is not able to fight the bacteria that is going to cause the oral health disease in your mouth, especially what we call periodontitis. Exactly. So we have microorganisms or bacteria that is affecting your gums. Generally or normally, it's a very slow process. But if you have diabetes, what is going to happen is that it's going to affect your immune system. Your immune system is not working as well, and so the process is going to be faster. We understand. And then that is going to increase your risk. So if you have diabetes, you have like a 2 to 3 times increased risk of developing periodontitis. Also, the reverse is true, in that if you have periodontitis, it's going to affect your sugar control. So the first that I said is mainly if you have poor sugar control as a diabetic. So if you also have periodontitis, which is you have a lot of plaque, it's affecting your gums, you're having gum diseases, you're not doing anything about it, you have bleeding gums, your gums are red, you're not doing anything about it, and you are diabetic, it's going to make it more difficult for you to be able to control your blood sugar. Because what it's going to do is that it's also going to affect it's going to increase your inflammatory cytokines. That is going to make you more insulin resistant. So already as a diabetic, you are insulin resistant. Either you are not producing enough insulin or the insulin you are producing is not working well. Now it's going to even be more resistant to it. So research has actually even shown that if you are controlling your periodontitis or your periodontal health, you are keeping a good periodontal health as a diabetic, it can actually decrease your blood sugar levels.
I see.
Also, like I said, heart diseases. Exactly. So even the bacteria that causes periodontium can actually seep into your blood. Like I said, if you have periodontitis or gingivitis, your gums are going to be red. They're going to bleed. So these gums can seep into your blood. They can get into your heart itself, infect your heart valves, give you a problem. It can cause inflammation in your blood vessels, increase the pressure, can give you high blood pressure, which is hypertension, which can also lead to stroke and everything. So we are saying that Most people don't take their oral health seriously.
That's true, and it's good knowledge to also know that
exactly
how connected it is to these other chronic diseases.
Exactly, that affects most of us. So some research papers will even tell you that even periodontitis can increase your risk of developing diabetes. Like you may probably don't have the diabetes, they are saying that, oh, I'm fine, I'm okay. But this whole process, like I'm saying, if it's going to make you more insulin resistant, then it's going to also increase your risk of developing diabetes. So it's very important. It's underrated, but no. If you do these simple things, it's actually going to keep your whole body.
Because we've been told
healthy.
that when you brush your teeth, you are fine. So I mean, like a lot of people brush their teeth and then, you know, they don't think that they should go and have it examined until, you know, something hurts.
Yeah.
So what are some of the best ways to help children keep good oral hygiene?
So make brushing time fun. Also, I think that most kids don't like to brush their teeth, but as a parent, it's your duty to ensure that they are brushing. However you are going to do it, either you're going to make it fun. So there are so many musics and children's TV shows that have made so much songs about brushing, and buy them interesting or toy themed toothbrushes. Use children's toothpaste. They are not as harsh.
Like Kel Kids.
Exactly. They're not as harsh as the adult toothpaste. So it's more maybe strawberry flavored or apple. It's nicer. The children would want to do it more than if you give them the harsh minty one. Exactly. So these are some of the things that you can do to ensure that they are actually brushing.
I see. Well, parents out there, you hear. She says that Kel Kids strawberry flavored toothpaste is very good for your children. It's not harsh, which means that your children will not run away from brushing teeth time or teeth time. It's very safe for your children. It will help prevent a lot of the things that they've done, but also book an appointment to go see the dentist.
Yeah.
For the children too, is it twice a year?
Yeah, sure.
Twice a year. And then have their entire mouth looked at by a professional. But you can start at home with Kel Kids toothpaste.
Then on that note, I just want to say that.
Yes, I mean, at Ridge Medical Center, is there anything for our viewers and anybody who comes across this?
There most definitely. So Ridge Medical Center will be doing a promo in the month of March. So we are going to ensure that for every consultation in the month of March, it's going to be free. And then also, we're going to get a 10% discount on every dental procedure that you're going to do at the Ridge Medical Center in the month of March. You can call, book an appointment, ask for direction. We do it's a whole clinic. It's not just a dental clinic.
I see.
So you can call in for all your inquiries.
Doc, and Edumedian has been very educative. What church and Yama Bebre? It do time I but before then, no. So, Sinhuejuma, Senator Trema, and dentist is the only way I can describe it. And you know, your sponsor saying Tisadia, Yama products. Unim your products in dada. Kel Kids, Kel Chaco, and a Kel 360. Ninyine biwaha. I think so. The PL shows super said that was to say. Wabanti, I'm a very special magna. Doc, this is for you.
Thank you.
Thank you
so
too
much.
for coming. We
glad
appreciate
to be
you so
here.
much.
Sure.
Yes. And then you made the baby. That was the same. I was sharing next week and so another sene Sayem review na sharing. But this is all we have for you. Keep your oral hygiene great. Keep it clean. Keep your mouth clean. Keep it healthy. Book an appointment with your dentist. And there's one way you can keep your mouth clean before you see your dentist, and that's using the Kel toothpaste brand. Yes, sponsors for Edumedian. And yes, I will sponsors on Kwan. They be a makeup or make me fee. We na ye use until so kona kotobi na use. My makeup is by Cover GH Beauty Experts. I'll see you same time next week. Bye bye.